June the 2nd. We are joined today by our CEO, Nicole Dupuis, as well as our Acting Medical Officer of Health, Dr. Shankar Nesathure. We're going to start with opening statements from Dr. Nesathure, and then we will move into questions from the media. Thank you very much. Go ahead, Doctor.
So thank you, Ashley. Colleagues in the media, thank you so much for allowing me to speak and allowing the Public Health Service to share our perspective today. I want to talk today about vaccines. In short, vaccines save lives. Vaccines save lives related to diseases such as measles, mumps, German measles or rubella, meningitis. And it's an important part of how we can keep young people safe. In 2020, in Ontario, there were approximately 100 cases of whooping cough, 50 cases of measles, 22 cases of meningitis, and regrettably in 2000, there were deaths of meningitis. In 2020, 19, and 18 taken together, there were 12 people who died of meningitis. Getting vaccinated reduces your likelihood of developing these diseases, and it also keeps our community healthy. And I would encourage people to get vaccinated and be up to date on their vaccine. The reason we're talking about this today is Ontario has a process of vaccine verification. And what that really means is that in Ontario, the public health law creates a framework where the Public Health Service can verify that young people are up to date on their vaccines. And we're starting the vaccine verification process. The vaccine verification process means that young people and their families have to provide records so that we can ascertain that people are up to date on their vaccines. Right now in Windsor-Essex, approximately 13,000 young people are not up to date on their vaccines. We do not have documentation that they're up to date. Some of those individuals have received their vaccines but have not forwarded the documents. And then another group of people have not received the vaccine at all. Our core message is that it's important to get up to date on your vaccine. And as part of the vaccine verification process, if one cannot demonstrate that they're up to date or compliant, that there will be young people suspended from school in September. We want to do everything we can to avoid suspensions of young people. School is important, but vaccination is also important. The benefits of vaccination and being up to date are for the young people at the current time, meaning that if you're up to date now, you're less likely to get a vaccine-preventable disease. But the benefit is actually beyond schools. Our goal is to keep young people healthy in school, but beyond the time that they leave school. And it may have some effect also on keeping the next generation of young people healthy. To this extent, we want to make sure that mothers who are pregnant mothers are up to date on their measles vaccine and the chickenpox vaccine and the rubella vaccine. And getting young people up to date when they finish high school means that they will remain up to date into young adulthood. And that too is an important part of trying to keep the community healthy. I'm happy to answer any questions, and we're happy to answer any questions on this topic.
All right, thank you very much. We'll move into our first round of media questions, starting with CBC.
Yes, good morning. Dr. Nesathure, did you say that 13,000 young people are not up to date or you don't have documentation? And did you say there were forged documents? I'm sorry, I might have misunderstood.
No, I didn't. I don't think I don't think that I didn't. I don't think we had commented on any forged documents. There are 13. Our best estimate is there are 13,000 young people whose vaccination status is not up to date. Some of those people, the documentation, they have had their vaccines, but they've not forwarded or updated their documentation. And another group of people in that 13,000 have not received the full series of vaccinations. including those particularly important vaccinations like the meningitis vaccine.
Thank you. Sorry about that. I did mishear. And I believe this is our last media briefing for a little while, or for COVID-19, I should say. I was wondering if you and Nicole had any thoughts you wanted to share, any reflections on that?
Yeah, I think we're in a quiescent period of COVID right now. That's likely a function of decreased disease activity, but it's probably also a function of the summer season. I think we should continue to monitor the burden of COVID-19 on our community. We have some challenges we have to consider. We can afford the exact number, but I believe only about half of all people eligible for our vaccination are up to date on their vaccinations. And if we have a resurgence of cases, one of our approaches at a community level is to try to vaccinate, keep people up to date on their vaccines. Also, I think we're seeing a resurgence in flu cases, and that in part reflects there's more human-to-human interaction at this time, and there's a relaxation of public health measures. So, part of the job of the Public Health Service is to monitor the current situation, and I remain hopeful that disease activity will remain at a lower level, but we're always monitoring for disease activity, and we'll be happy to share updates as time goes on about where we are in the public health field.
Thank you very much. We'll move on to questions from Blackburn.
Yes, good morning, Dr. Necessary. I wanted to ask, 13,000 sounds really high. Can you tell me if that is up over last year or the past years? And if you think that's simply because, maybe people didn't keep up to date during the pandemic?
So perhaps I can ask Nicole to comment on that.
Yeah, so we don't have a number. I couldn't tell you the number for last year because we did not do a suspension last year or the year before. And I just wanted to remind this, it's a little over 13,000 students, and this is just secondary students. So there's quite a number of additional students that would be in elementary as well. I can't speculate. I would assume that's a much larger number. We could look back to the last suspension and give you some idea based on that, where we were at and how different we are now. But yeah, we know during the pandemic, access to vaccination was an issue. Both, obviously, we were not out in the schools performing our regular vaccines in the schools. And also, there was limited access to primary care, with the exception of, emergencies for much of the pandemic. So we suspect quite a bit of it is related to that, as well as Dr. Necessary said. We anticipate traditionally when suspensions from any public health unit go out, we anticipate at least probably half of those are just records that are not in the system that need to be updated. And so there's a, really simple process for doing that. It's done online, and any family or youth can go on our website and look at the process for doing that, and it's quite simple. So first notices have gone out, and our hope is that we'll have no actual students suspended by the time we get to the first day of school, the 2022-2023 school year.
Just to clarify, 13,000 secondary school students only?
Correct.
We don't have a number for elementary?
We can get you probably the number for overall what are out of date. We're starting with secondary students. We will be moving forward in the next school year with a suspension related to elementary students as well, but it would be an overwhelming number all at once.
Okay, that helps. Also,
if I could just supplement that.
Yeah, sure. Go ahead.
It's fair to say that the routine healthcare or the scheduled healthcare of many families has been disrupted by COVID. Part of that has been the vaccination program. And it's just not the disruption to access to primary care physicians and specialists, but also services at the public health service. if we look at the key items for vaccine, our vaccination rate for human papillomavirus, I believe, is 1%. It's pretty low. And one of the important things moving forward as we learn to live with COVID is to get back to managing other medical problems, managing scheduled medical care so people have access and can maintain their health. So, I think in part, not exclusively, but in part, the reason we have 13,000 young people not up to date or not up to date is because of the pandemic and the sequelae of the pandemic.
You said 1% are covered by the HPV vaccine at this point? Is that locally?
I think that was our estimate, was 1%. Here's the thing. The HPV vaccine prevents cancer. It prevents cervical cancer. It prevents anal cancer, penile cancer, vulvar cancer, throat and mouth cancers. As it relates to cervical cancer, there were 200 women who died of cervical cancer in Ontario last year. If we can get our vaccination rates above 90%, we might be able to save, I think, about 1,700 lives over a period of time. And right now, our vaccination rate for HPV is poor. We need to improve our HPV vaccination rate. I know it's uncomfortable. For the vaccine to work at best, be most effective, we have to vaccinate boys and girls before they're sexually active, which means at age 12. And I know it's difficult for parents to contemplate the sexual activity of their children at some point in the future when they become young adults. But it's really a priority to get young people vaccinated for HPV. And it's a vaccine that prevents cancer, and it's something that all of us as parents can do to help our children. So I would say that we would really urge at the Public Health Service for everyone whose child is not up to date on their HPV vaccine to get them vaccinated. Now, how did the pandemic affect us? Well, we used to vaccinate children in schools. Nicole will correct me. We used to vaccinate them in schools at age 12. And then we used to do the subsequent vaccination in schools. With the pandemic, the Public Health Service was not able to go to schools to provide that service. And now we're in a catch-up mode to try to get young people up to date on their human papillomavirus vaccination. It's a real priority and something that parents can do this summer as the school year ends to help their kids. Nicole, I hope I captured all the key points there.
Yeah, I'll just clarify that the suspension's related to all, to being up to date on all vaccines. So HPV is one very important vaccine, and Dr. Nestory is correct. We weren't in schools performing those routine vaccinations, although we did try to provide vaccination, through primary care where possible. But it is related to all, routine vaccinations. So, any individual child could be out of date for many, or it could be one, as we said, that it could just be a record issue as well.
Thank you.
Thank you. We'll move to questions from the Windsor Star.
Good morning, Dr. Nestory. I understand and appreciate you emphasizing and prioritizing the HPV vaccine, but even the COVID vaccine, our numbers have not changed at all in any substantial way for literally months now. How frustrated are you that there's a section of the public that is completely resistant to vaccination, that will not vaccinate despite your education efforts, despite the pop-up clinics?
Yeah, I think I'm gonna try to give a nuanced response to that. It's complicated for sure. I think for the vaccines covered under the Immunization for School Pupils Act, meaning the vaccines that are required, that there's vaccine verification for, the overall adherence rate is, I think, approximately 90%. And Nicole can correct me. It's actually pretty good in previous years. And we can get you the exact numbers. So I think when people are provided an opportunity to vaccinate their children, the vast majority of people do vaccinate their children. I think the vaccines that we have for children, for measles, mumps, rubella, whooping cough, have been given for decades. And I think that people, if presented with the opportunity, are likely to get their young people vaccinated for that. As it relates to the COVID vaccine, it's a little bit more complicated for sure because of, and there's a whole variety of societal and cultural reasons why people may have reticence about the COVID-19 vaccine. But as it relates to vaccination for children, and especially since they're tried and true, I would anticipate that when people are provided the opportunity and provided the knowledge that they will ultimately get vaccinated. To the second point, and the question you asked is, the role of the public health service and the role of doctors and nurses and other people in healthcare is to provide guidance and education. So in our professional practices and clinical practices, we anticipate that we'll have to have dialogue with patients, families, caregivers, to come to a treatment plan or a management plan that satisfies both the patient and also achieves the public health goals. So for me, I'm happy that people are able to articulate their perspectives, and we look forward to their dialogue. In some cases, the evidence is so overwhelming that we can recommend an intervention in a very straightforward way. And in other times in medicine, it's more complicated and more nuanced. With regards to vaccination, it's probably one of the most effective public health interventions we have. Doctors, I think, vaccinate their children on a routine basis. I think that that we'll just continue to have the dialogue with community members who might be reticent or who may have questions about vaccine and vaccine programs.
Do you have any fear or concern that the pandemic may have galvanized anti-vaccination rhetoric amongst people, not just towards COVID vaccine, but other vaccines?
I think there's always a subset of people who are reluctant to accept any medical treatment or intervention. I think their voices may have become more prominent during the pandemic. I also think that the pandemic overall has led perhaps to a greater coarseness in the dialogue among community members and among institutions or between institutions. But I think that most people defer or accept the guidance of their physicians and their healthcare providers when given a rational explanation for the recommendation. And so I remain optimistic that people will continue to get their young people vaccinated, and people who are adults will choose to be vaccinated for diseases that have significance to them.
Thank you.
Any questions from AM 800?
Nicole, like you mentioned, first notices have been sent out. So what are the timelines here? They have until the beginning of September when the school year starts. And then at that time, if they are not up to date, then that's when the suspensions will start to be, I guess, issued?
Correct. So our process is always, we put out a first notice. This is to capture anyone that is out of date. And then we start, obviously, to get a lot of calls. We work with the community to either review records, help parents and families, or get their records updated if that's the case, as well as locate either through our services or through their primary care, to be vaccinated if they need vaccination. We will put out additional notice before the end of the school year for those who at that time are still out of date. And then the actual suspension date will be the beginning of the school year. So, before the end of the school year this year, our hope is to be able, we'll send out that notice to let any outstanding students know that, if they're not up to date by the beginning of the school year, they will then be suspended at the beginning of school.
I believe Adele asked this question, but maybe a follow-up to this. But when you saw the 13,000, when the team brought it back to you and others, just your thoughts when you first saw the 13,000.
It's a very high number relative to the number of students we have in school. But as we, both Dr. Nesathury and I indicated, we do think, a good majority of those are actually just records that have not been updated. So individuals have their vaccination, but not unanticipated that we would have a number of students that are out of date, recognizing, the access issues over the course of the pandemic, and as well the diverted attention towards COVID-19 over the past few years. So, it was really important to us in the service to make sure that we get these notices out and we ensure that, everyone is up to date again on vaccines for other vaccine preventable diseases that, are really important and also, save lives.
If I could supplement that, 13,000 is a staggering number. A family doctor might have 1,500 patients in his practice or her practice. But 13,000 is, on the face of it, is staggering. But it's also an opportunity to get to 13,000 people and to change their lives. We had 12 young people or 12 people die of meningitis over the past 3 years. We got to get our vaccination rates up so that we can try to minimize deaths related to meningitis. 100 people have whooping cough. If we can get to people vaccinated, we might be able to prevent cases of whooping cough. Many of the young people who are not up to date on their vaccines will ultimately become mothers. We want to make sure that mothers are up to date on their vaccines so that their unborn children will not be exposed to vaccine preventable diseases. So at one level, the number is overwhelming at one level, but at another level, it's manageable. It's like everything else in medicine. You have to know the problem before you can deal with it. And now we know the problem. And we're here meeting with you and trying to get the message out to the community that if we deal with this, we can get young people up to date with the minimum of disruption to their families and to their school experience.
Thank you.
Any questions from CTV?
Yes, good morning. Just for some clarification, okay, so you said 13,000 are not up to date, but how many secondary students in total are up to date? As in, what's the total pool or percentage?
I can't give you the exact number of students off the top of my head, but it's approximately 20. There's approximately 20,000 in that age group. So it's a large proportion of students that are out.
And those 13,000 face suspension in September?
Correct.
Okay, thank you.
The way I characterize this is, if I could just supplement that, those 13,000 people, young people, have an opportunity to get up to date on their vaccinations. We don't anticipate 13,000 suspensions because we think that from previous experience, the vast majority of people send their documents in a timely manner, or if they arrange for their young people to get vaccinated before the suspension process comes into effect. The Public Health Service is extremely reluctant to interrupt the school lives of children and young people. And so we hope that by having this dialogue now, that it'll give people and families time to come up to date so that they can protect their children as they emerge or join adulthood.
So that must be a large undertaking for the Health Unit, even just to send letters to 13,000 students and families and follow up? What kind of a staffing kind of does this involve for the health unit?
So we continue to have a very large amount of resources dedicated to vaccination, both COVID vaccination and catch up on routine childhood immunizations. So I couldn't give you the exact number of staff that are assigned specifically to this task, but it is a very large undertaking. Certainly to send out notices. Then I mentioned it's that record review and helping parents sort of navigate and make sure that they are able to enter their information properly and or find, have access to the vaccines that they need. So it is a lot of work. Our team is out in the community. So you have probably seen, and we've been posting to our website. We've been working very closely with our municipalities who've been incredibly generous and gracious in offering us their spaces to provide both COVID vaccine and some of these catch-up vaccines for children and youth. As well, our team will be working, and has been working very closely with our school board colleagues. And, we'll certainly focus on making vaccination as accessible as possible. And as well, record review as accessible as possible. So we will be going out into the community to try to be more available and ensure that we can, better help families and youth navigate this and make sure, as Dr. Nestor said, we anticipate, as always, that majority of the students of the 13,000 actually have records. They just need them to be inputted. And for those who need the vaccine, we know that they will. Our experience has been that people, do take that opportunity and get vaccinated, and we won't have as many by the time we get to the school year. But it is definitely a lot of work and a huge undertaking. And we have a very large team in vaccine working on all of these projects right now.
Thank you.
We'll move to our follow-up round of questions, starting with a question from CBC.
I think I'm good. Thank you.
Is there a follow-up question from Blackburn?
No, I'm good. Thank you.
A follow-up question from Windsor Star?
Yes, just to reiterate a question from my CBC colleague earlier. This being the final media briefing concerning COVID. Dr. Nestor, do you feel any sense of closure? Should the public take any sense of security that the level of the pandemic at this stage does not require regular briefings by the health unit?
Health unit's always available to answer questions, deal with new and emerging public health issues. We're always available to have dialogue, both through Ashley and Mike, and as well as through the rest of the public health team. COVID-19 is not going away. It may be in a more quiescent phase now, but I think that as we go forward, we will need to learn to manage and live with COVID-19 like we've learned to live and manage other infectious diseases. And that includes diseases such as HIV, influenza. There will be periods of increased disease activity, and as it relates to COVID, there's likely going to be periods of increased disease activity and decreased disease activity. I anticipate that during periods of increased disease activity, we might have greater public health measures. I think that it's likely that moving forward that we'll have access to more potent and effective antiviral medications, which I think will be helpful. I think that we're going to need routine or regular vaccination of people against COVID-19 moving forward as well. I don't think that the scheduling of media briefings in itself signals a lack of commitment or a lack of emphasis on COVID-19. I do think that the discontinuing of the media briefings merely reflects the fact that we're working to normalize, to recognize that COVID-19 is going to be a normal part of our public health management plan moving forward.
All right, thank you.
Is there a follow-up question from AM 800?
Yes, just one for Nicole. Nicole, it's been 1 year since Gary McNamara announced that you are the taking over as CEO, and I know you didn't take the job until July 1st officially. But I guess just this past year, how would you describe it? I'm guessing rewarding, but there's been some ups and downs along the way as well.
Yeah, there's definitely been some ups and downs. Yeah, no, I have reflected on the past year. I think I was quoted many times saying I'll be working on recovery in my first year, which we had some unexpected turns for sure. But no, I've been really grateful to be part of an incredible team, and I probably said that last year, and it remains true. And I'm proud of our service. Grateful to have been working with Dr. Necessary this past year, and it's been a really challenging year for the community and for us. And we've continued to sort of persevere and move forward. And even though this is not our last media briefing, I know we keep saying that, we're just hopeful that we can take a break, and glad to see that we're at a stage where things are a little bit stable and we can start to work on some other, public health issues that are, very important. But it's been a challenging year. I hope I've done well, and definitely looking forward to the future. But until you asked, I didn't even realize it had been a year, Rob. So thanks.
Thank you. Thanks for everything with these briefings. Like you said, I know they're not done, but no, I'm guessing all my colleagues will probably say the same. We appreciate everything.
And maybe I'll just add, I know we've said this before, but thanks to all of you. Dr. Necessary has noted it many times, as well as I. We definitely, these have been a really important part of getting information to our community. And so, we're really grateful for the collaboration with our media colleagues and helping to get important public health messages out there and bring information. It's without you, we couldn't be bringing information to the community the way we need to. So thank you. And, again, not the last, we're always here, and hopefully we'll have lots more exciting public health work ahead of us.
Thank you.
One follow-up question remaining from CTV.
Yes, just one. Any update on the filling of the medical officer of health position in a permanent capacity?
That's a really great question, probably for our board chair, but we are still working with our recruitment firm and through that process. So I don't have any update to provide, but hopefully we will have some updates in the future, and still working on that. But again, every time this question comes up, I have Dr. Necessary right in front of me, and grateful to have his leadership with us, and he'll continue on to support our unit. And so we're in good hands.
Okay, thank you. And like Rob said, thank you for all of your time and devotion throughout these media briefings. We appreciate it.
Thank you.
That concludes our media session for this morning. As has been mentioned, this is our final planned media session for the time being. Thank you all very much for joining us, and have a wonderful day.
Thank you. You too.
Thank you, everyone.
Thank you.